Good evening. But first, to a crisis behind the prison walls with a damning report showing HMP Leeds having the most inmate suicides in the UK. Inspectors have found that since 2022, 16 people have taken their own lives inside Armley Jail.
Drugs misuse and overcrowding have also been flagged as serious issues by the Inspectorate of Prisons. Well, Vicky Smith joins us from outside the jail in Armley. And Vicky, tell us a bit more about the site itself.
Well, this is a Category B prison and it was built back in 1847, originally designed to hold around 640 people. But now, at its capacity, it can hold around 1,100 inmates. Now, inspectors today have said that cramped conditions, drug abuse and rising suicide rates are of critical concern and are calling for immediate action to be taken.
Overcrowded, 22 hours a day spent in cells and stretched mental health services. That's how life inside these walls is described in this report. With the number of suicides rising, inspectors have called for urgent improvements.
Just an happy lad, he didn't deserve not to be helped with his mental health.
But that's something that comes too late for the family of Rhys Godward, who was 23 when he took his own life in Armley Jail 2 years ago.
Me and my daughters had rang the prison up, concerned about his mental health several times from the day after that he was sent in there, and they just used to say, oh, he'll be okay as an adult.
Rhys had been sentenced to 6 months for assaults and shoplifting. He'd spent just 12 days inside when he was found dead. The watchdog found staff had missed opportunities to assess his risk.
Rhys were crying out for help and he were told to just basically shut up. He was swore at. He was basically bullied for having mental health right to the day that he took his own life. So I don't think they look after any men in Armley prison.
That care was scrutinised by inspectors on a visit to the prison in July, finding that support for new arrivals was not good enough. Concerns were also raised about living conditions. This is one of the cells pictured in the report. It said 78% of prisoners lived in overcrowded cells designed for one, and nearly 1 in 5 inmates said they'd developed a substance abuse problem whilst behind bars.
What we found on this inspection, which was particularly concerning, was the amount of overcrowding in the prison, the amount of prisoners who were taking drugs, and particularly the number who had acquired a drug problem since they'd been in the jail. But I think above all, what worried us most about Leeds were the number of suicides, that there have been 16 since our last inspection in 2022. And actually, since we were in the jail earlier on this year, we've actually heard that there have been another 2 more.
In a statement, the Ministry of Justice said this concerning report underlines the crisis this government has inherited in our prisons. We are already taking urgent action to address the number of self-inflicted deaths at HMP Leeds, including improved staff training and creating new specialised cells which ensure constant oversight of prisoners who may be at risk. Social justice charities have described the findings as deeply troubling, saying that support inside facilities needs to change if the government is serious about safety and reducing reoffending. Vicky Smith, ITV News, Leeds.
Well, one of those charities is the Howard League for Penal Reform, which aims to reduce offending and the prison population. I spoke to Andrew Neilson earlier and began by asking for his response to today's report.
It's a very concerning report, and it's indicative of the fact that Leeds is one of the most overcrowded prisons in the country. It is designed to hold about 640 men. In practice, it's actually holding close to 1,100 men. The vast majority of people in the prison are spending up to 20 hours a day in that cell doing nothing, so with no access to work or education or any kind of positive rehabilitative activity. Now, that is a recipe for a lot of the problems that we see across the system in terms of drugs and violence, but also also specifically at Leeds a lot of concern around safety in custody. We have had 16 self-inflicted deaths at Leeds over 3 years, and I think in any other public institution, if that was the case, we would have a public outcry, calls for an inquiry. So it's very concerning to see that Leeds is unable to keep people safe.
There will be viewers, though, watching tonight who will have little sympathy for the inmates who are locked up at HMP Leeds. Prison, it's not meant to be pleasant for those who break the law, is it?
Prisons are not meant to be pleasant, but the punishment is being sent there and having your liberty detained. We're talking about people who might not have a job, who might be homeless, who might have poor drug and alcohol addiction, or indeed poor mental health, which certainly seems to be part of the major concern around Leeds at the moment. Now, if none of those issues are being addressed, if you're simply being asked to lie in a cell all day in a very distressed environment, then the chances are you will be released and you'll be more likely to commit crime rather than less. And that's why this should matter to all of us.
Well, the Ministry of Justice says it is taking what it calls urgent action, including creating special cells to monitor at-risk inmates. Do you think this is enough to stop these self-inflicted deaths? And if not, what more needs to be done?
Well, they are taking action in Leeds specifically with that in mind, and more generally there is a sentencing bill now before Parliament which is looking at trying to reduce some of the pressure on the prison system in terms of the amount of people it is holding. The sentencing bill I mentioned won't come into implementation for about a year, and so prisons like Leeds are going to continue to face these kinds of intolerable pressures.
Andrew Neilson, thank you very much for speaking to us tonight.